Good evening, everyone. Welcome into our today's TBN Wellness special episode. Today, we have a very special guest with us in the studio. We are honored to have a very special psychiatrist who traveled all the way from Canada to join with us, Dr. Sanjay Siddhartha. Dr. Siddhartha, welcoming you into our today's discussion, and thank you for joining with us.
Thank you, Dr. Hafsa. It's an honor and privilege to be here. I have heard a lot of good things about your channel.
And we are really honored to have you with us today. Being a psychiatrist, I know that you are very much passionate and driven to bring true changes in the community and the people around you, and we really thank you for your work.
You're most welcome, and thank you again.
Dear viewers, so today we will discuss very important thing from psychiatry. We know in this current world, it's a real challenge to deal with a healthy mental health. So today we're going to discuss about some very common issues. Among them, we will try to discuss bringing help for the people who are struggling with borderline personality disorder and bipolar disorder. And we will also try to discuss some points from schizophrenia and nonetheless depression. So we are going to starting our discussion today, and we hope by following our discussion, you will get and find some help for yourself and for your known one. So Dr. Sanjay, I know that you had been working for many years, and you completed your MBBS, and then you completed your MD, and currently you are working in New Brunswick in a psychiatry sector. I would like to invite you to mention some of your major works and your current position, please.
Thank you very much. So currently I'm the Chief of Staff of Miramichi Regional Hospital. I have been practicing as a psychiatrist for 28 years in Canada. And prior to that, I was in England for a few years. And before that, of course, I did my post-graduation from India. So yeah, it has been a long journey. I have been passionate about psychiatry and mental health. And I think that drives me to help people to the best of my ability with what I have gained over years as experience, as training and experience.
Thank you so much. So at the very beginning, I would like to ask you a very important thing I found, especially for this modern world. I found like many people, like highly professional people, they are from higher educational background, working in very responsible position. But I found many of them dealing with depression, isolation, and loneliness,
Yes.
even when probably they're leading a huge organization or company or community or even maybe state. So I would like to ask you, is this because of their work pressure, responsibilities, or this is something also have to deal with this modern day lifestyle?
That's a very interesting question, and thank you for asking me. Dr. Hafsa, I would like to say that the tensions and stressors always existed in every society during various timelines. You have mentioned about your own experience in Bangladesh and how you're educated in Dhaka, in premier schools and premier medical schools, and when you went to the countryside, you found the real Bangladesh or real South Asia, if I may say. And that, so I would perhaps like to put forward this question to you, that the stressors, would they not exist in different forms in all different times, in all different locations? See, we often say that the modern day lifestyle had got us in a difficult situation with so many pressures, and that's true. The person would face the hustle and the bustle, the rat race, if you like, and against the countryside we would like to face, see that doesn't exist. But you had seen when you went to the countryside, as you were saying, the real world opens up. The problems with, if I would say, with hunger, the problems with infectious diseases, the problems with domestic violence, they exist there too. And I mean, similarly, if we may go back in time, those times for which we try to glorify a bit, the Middle Ages were not very good. If our emperor, Raja, or the Bacha wanted to kill someone just on a whim, they could do that. And there was not efficient governance at that time. People would be burned for being witches and whatnot in the rural countryside and even in cities. So that has happened throughout. So Middle Age was not good. Going back to prehistoric days, there was a tension again. The tension whether my father would ever bring some food at home or losing a child with an accident was not good. So the tensions did exist, always there. Stressors always were there. Though they have changed over a period of time. And you're right, that rat race and leading a dual role, the transition of role, had made things a bit different kind of stressors have come.
But I also want to know from you, because you deal with huge number of patients and you do lots of voluntary work and lots of other related work, so your exposure with people is very huge. So from your experience, I want to know, like, do you also think nowadays being very highly ambitious is another trend of this modern world, like professional people?
Yes.
And do you provide advices to your patient, whoever are coming from that background, and complaining to you about their depression?
Yes, and that's a very important thing, and that, if you like, an artifact of our capitalistic society. More I get, better I would be. The bigger car, the bigger house, more prestigious designer label clothes would put me higher. Or if my colleagues or my neighbor are having a bigger car, bigger house, and better lifestyle, of course I would feel envious. And that's where the rat race starts. So there has to be a moderation in that, and where we go with that is very important. It's what exactly are we here for? What do we want to achieve in our life? What kind of a mark do I want to leave for the world or in the community where I live? And that's where I have to get into, do some introspection, get to that feeling that here I am to help my own neighbors, the mankind, if I could, in a smaller way and maybe in a bigger way over a period of time. So that conversation always happens. As a psychiatrist in a small community, I would always know all the families, and that's, that becomes your passion of sorts, to help people there, to go in that way. And try to tell them to spend some time doing volunteer work, help your neighbor, help those who are disabled, who are seniors, help the people who are dispossessed and children who are deprived. Yes, so that's where my passion lies.
So as a psychiatrist, you would emphasize that for having healthy mental health, this is very important to know where to stop, slow down in life, and definitely go back to nature.
Yes, and going back to nature doesn't quite mean that living off grid, but it would always mean that be more responsive to your community needs. Go and try to help the best you could in the community help and neighborhood, and go to the basics, as you say. Do I need all that? Should I look more at the broader perspective, the environment, helping the poor and dispossessed?
Thank you so much for sharing all your advices and your vision. So now I would like to know about borderline personality disorder, because I found nowadays this is very common issue in our community, in the society, and around the world. And I found this is also your personal interest. You had a lot of work in borderline personality disorder. So first, I would like to ask, like, if someone is suffering from borderline personality disorder, so what are the most important and common criteria? And like, how can someone understand that he or she might be dealing with borderline personality disorder so they can reach out for help?
Because people sneeze. Because not everyone washes their hands. Because kids touch a lot of things. Set a date to get your COVID shot and RSV if eligible. Because if you're wondering, should I get my COVID shot? Think about other people. Learn more at nj.gov/health/vaccines.
Right. Thank you. And the borderline personality disorder is really close to my heart. It's a passion of mine. And the person who evolved, if you don't mind me going in the background, was John Gunderson. John Gunderson brought borderline personality into the Diagnostic and Statistical Manual. That's the compendium of all psychiatric illnesses. And in 1980, back in DSM, Diagnostic and Statistical Manual, called as DSM, the third version in 1980. And he put down the criteria as someone who has short depressive features lasting for a few hours. The person would have self-harm. The person also would have chronic feelings of abandonment, boredom, impulsivity. But beyond that, beyond these criteria, he also emphasized before his death that it's not everyone who self-harms has borderline personality disorder. And unfortunately, that's what is practiced. If I'm a busy mental health professional, I find a young person, usually a girl in their teens or early 20s, would come and they have self-harmed themselves. I'll call them borderline. That's not quite borderline. The context is very important here. So John Gunderson emphasizes that usually in romantic settings, typically a young girl or a girl in early 20s is feeling abandoned, that it's intense interpersonal relationship that has developed, and because of the real or imagined abandonment, the person is going to self-harm. It fluctuates, the mood fluctuates quite a lot, the self-harm happens, the feelings of abandonment comes. And that is usually the context, not a context if I'm a 65-year-old male who is self-harming for some gain, say for insurance purposes, or unfortunately if I'm imprisoned in an institution.
It's mostly the feeling of abandonment.
The feelings of abandonment in romantic context, intense interpersonal relationship. That's how he describes in a romantic setting. So fluctuating mood, and that leading to self-harm usually, or feelings of impulsivity. That's what would lead to us to diagnose or suspect borderline personality disorder.
Thank you so much for describing it in a very simple manner. So next, for someone who has been diagnosed with borderline personality disorder, so how we can bring out help for them? What are the common treatment and management for borderline personality disorder?
Right. So first thing to explore a bit, Dr. Hafsa, if I may, is that the prognosis is very good here. So they say 20%, over 20 years, 98% of people would get better on their own. So it's only the urgency of the treatment at that time. So the treatment mainly consists of talk therapy, the psychotherapy or the behavior therapy. Traditionally, It's the dialectical behavior therapy propounded by a person called Marsha Linehan. She got it. She kind of conceived this treatment, but it's an elaborate treatment. It's a manual-based treatment. It requires extensive training, it requires quite a bit of expense, and it requires involvement of the person. So it's not always practical, and not always that you would get the teams who would deliver deliberate, DBT or dialectical behavior therapy. Later on, John Gunderson devised a therapy, and that is a very practical way of dealing with borderline personality disorder. And that therapy consists of, is known as General Psychiatric Management, GPM. And that's very simple. So they say, if I may describe it, number one, act or think before you act. So usually what brings us that person to attention would be this, that the person has self-harmed themselves, So how, think before you act. Think before you act. Count backwards, as our grandparents would have told us. So count 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, and the impulse to harm yourself goes away.
So those kind of things you actually put in the training when you counsel the patient.
Right. The second thing is, as they say often, that more work than love. So we know romantic love is always iffy. If I love someone so intensely, whether my love would ever be returned in the same measure. And you can't love someone in the same measure over a long period of time. And if you are young, it becomes even more of a problem. Whether that person loves or she has not texted me back, that means she has abandoned me and she has gone to someone else or whatever has happened. So I would have this kind of a panic feeling. So if I am involved in my day-to-day work, I have a schedule between 9 and 5 or whatever, then I have those challenges of the workplace. So my focus would not be so much at my love and whatever that person would be doing or would not be doing, and that my emotions are not predicated, if you like, on that idea that she has or he has abandoned me. The third part is the psychosocial rehabilitation. Very easy about that the therapists themselves would give examples from their own life and how you can convey it to people with borderline personality disorder, that how they can inculcate those habits or those traits so as to cope with it. So this is as good as others. GPM is a standard treatment. Now sometimes medications are also given, and those medications would help some people for some time, but medications are not the cornerstone of the treatment. Just because you have borderline personality and depression, you would not start giving medications right away. And medications have very, very minimal role. That's what the wise people have said for borderline personality.
Now the next thing, yes, I would like to ask you about the most challenging thing I found about psychiatric patient. It's the social stigma. The stigma is still there. Even I found even the most educated person, if he or she is dealing with some psychiatric issue, they still feel, ashamed, or they don't want to admit that they have any psychiatric problem. People still found it, like it's a shame, or it's something we should hide about if someone has any psychiatric problem. Even I found the most educated person, still it's in the society, it's in the community, it's all around us in the world. We don't want to admit it, and we don't want to seek help. So what's your number one advice for all the viewers about this thing? Because at first we need to bring the person to us to ask for help, and then you can offer the help. If I'm not admitting, if I'm not coming to you to share my issues, then there is no way you can help me, right?
You are absolutely right. There is so much stigma all around, and stigma comes in the way of seeking help. The person would not be happy to seek help, the family would not rally around. I cannot be proud to say I have schizophrenia and I'm going for help. My employer would discriminate me. My family members may abandon me. And even if I may say, the caregivers, the primary caregivers often have the same stigma that would make them suffer. There is always a fine point about mental illness and the employability and stigma. And if you allow me, I can go over it, elaborate about
that.
Sure. Stigma would not mean that I would be able to do things. Just as if I have a fracture, I cannot run a marathon. The same way, or someone with problems, cataract in their eyes, cannot operate like a surgeon. The same way I would argue that someone with a very serious mental illness in the active phase of illness should not be forced to work. That person needs help and care. And at times, just to address the stigma, the employer goes to the other way by force coming them, oh, that's just like any other illness. Let's bring him back or bring them back and let them fly the airplane. Few years ago, if you remember, I think it was a Lufthansa flight, and the pilot unfortunately suffered with severe depression.
I remember. I think you were talking about the crash.
The crash that happened.
Yeah.
So that was a disaster. So it behoves on the employer to be helpful with that, to give them sufficient leave. And if it's impossible to treat it, ask them not to come to the job, as you would not like the person suffering with cataract to operate on as a surgeon.
And what would you like to share for the family member?
The same thing. Most of these illnesses are treatable. So go to your psychiatrist, get a referral to a trained psychiatrist, and they would help you a lot with that, or they can guide you in the right direction.
And there is nothing to be ashamed about.
Nothing to be ashamed about. It's just like any other illness. Be free with them. Don't hide anything from your psychiatrist or from your physician, so you can be helped.
Thank you so much.
Thank you.
Dear viewers, we are going for a very short break, and after the break we will bring more important topics. Stay with us.
Because people sneeze. Because not everyone washes their hands. Because kids touch a lot of things. Set a date to get your COVID shot and RSV if eligible. Because if you're wondering, should I get my COVID shot? Think about other people. Learn more at nj.gov/health/vaccines.
Dear viewers, welcome again into our today's discussion, TBN Wellness special episode about mental health. So, Dr. Siddhartha, I would like to ask you now about another important thing about psychiatric illness, that is about the definitive diagnosis. I know like many psychiatric issues almost have common same sign and symptoms.
Yes.
And I found many times like a patient keeps struggling to get the right diagnosis.
Yes.
So what would you like to share about this, and what should be your advice to the patients to get the right help?
Yeah. If you think you suffer with a serious psychiatric illness and you have already gone to your primary care physician or primary care worker or provider, as they are called, request referral to a psychiatrist. Here in the United States, a board-certified psychiatrist or some would say in Canada, the Royal College certified psychiatrist. So you are sure that you are getting a good quality care, as I'm sure that you would do the same thing if I suffer with, say, a fracture. I would like to be referred to a qualified orthopedic surgeon. So I would assert the same way you have to go that route. That's the basic thing. Do not go with the myths of the psychiatric illnesses or the mental illnesses or the tales that we are told by our forefathers or by our grandparents. It's not always because of the trauma or the black magic or because of the problems with your stress that things have happened. Some of the serious mental illnesses are caused by, as they call, faulty chemical transmission. And perhaps that has to be kept in mind, that those things have caused people to have psychiatric illnesses. But a well-trained psychiatrist would be able to decipher and help us.
Sometimes I found patient complain that they are getting the treatment for a certain time, but they found no changes in their symptoms, So in that case, would you mind to advise the patient to take for second opinion or,
Absolutely. As everything else, as with the surgeon, as with the orthopedic surgeon, as with the car mechanic, as with the plumber, you would go for a second opinion. You should get a second opinion. And if you are a good health provider, you would suggest yourself that, look, things are not working very well. Why don't we get a second opinion for you?
And there is nothing wrong about it, right?
No.
Because I found sometimes patient, they are already dealing with a psychiatric issue. So definitely their confidence is already hit.
That's right.
So I found the patient, sometimes they feel like I'm not treatable, and they start losing their hope.
Exactly. And that's a very good point, Dr. Hafsa, that we as a mental health care provider and the family members and most importantly the patient should go for a second opinion.
And do you also refer your patient commonly to get therapist help for counseling?
Absolutely. Many cases do not require the psychiatrist's expertise. Different expertise is required there. So say if the patient just needs psychotherapy, not just, but psychotherapy, then perhaps a psychologist is more capable of imparting that than if I'm not trained particularly well as a psychiatrist in psychotherapy.
Thank you so much, Dr. Siddhartha. So, dear viewers, another very important and common thing in nowadays world, which in mental health we call bipolar disorder. So, we would gonna discuss some point about bipolar disorder now. We will try to talk about common sign symptom. So whoever among us is dealing or struggling with bipolar disorder, we can understand that I need help and there is nothing to get help about it. And bipolar disorder is actually very common, especially in highly productive people. We know most of the genius people in this world, they actually were a case of bipolar disorder. So, Dr. Siddhartha, I would like to ask you now, what are the most common symptoms of bipolar disorder, and how someone can understand that that person might need help?
Right. So the bipolar disorder has, as the name would suggest, has two poles. Bipolar. So one is it's the high phase or mania. The other one is a low phase or depression. And they may come one after the other. Usually the high phases would last for several weeks or months, and the same way the low phases may last several months. Often, if I may, I would tell you that fluctuating of mood within a day, say I'm feeling very happy in the morning, quite irritable in the evening, and then sad later in the evening, is not usually the presentation in bipolar disorder. But there has been so much on social media that people self-refer themselves that if my mood is fluctuating every 2 or 3 hours or within a day, is it a bipolar disorder? No, it lasts for several weeks, several days for sure. So during the high period or the manic period of bipolar illness or hypomanic period of bipolar illness, I feel that I have enough talent or money or drive. So I would be doing things like spending a lot of money beyond my means. I would talk rapidly. I would take impulsive decisions. I would buy 10 pairs of shoes. I would buy 20 pairs of dresses. I would spend thousands of dollars on my credit card or hundreds of thousands of dollars in some cases. And then I would not stop for a moment. I would not sleep at night. I would just be working and I would just be causing enough damage to myself.
Full of energy.
Full of energy, walking rapidly, walking from one place to the other, driving car at a high speed, or spending a lot of money getting into situations, starting having affairs, casual relationships, and all, which would have huge implications. So that is the manic or hypomanic phase, and then comes the depressive phase. So depressive phase here would have sadness of mood, not sleeping at night, feeling suicidal on occasions, decreased energy, poor concentration, lack of interest in surroundings. I'll be confined to my bed in extreme cases. I would not like to go out, and of course. So that fluctuates. The poles go on, the episodes would happen every so many months. Predominantly though, over the course of your lifetime, if I have a bipolar disorder, is the depressive phase, which lasts much longer than the manic phase. In fact, sometimes you would forget that you ever had mania, or your primary caregiver provider, oh, you were always depressed. But it's very important, because from the point of view of management, it would be very different to treat that, how you treat that bipolar depression as major depression alone.
Thank you so much. So, we are almost at the end of our discussion.
Yes.
So before closing the show, I would like to ask you about your advices, and if you have any messages for our viewers about mental health and any other information you want to share.
Right. So I would just like to say that mental health illnesses are treatable with good help. So please, without any hesitation, go to your primary care provider, insist on a referral to a trained, qualified psychiatrist, and follow their advice. If there is nothing to be ashamed about, if you have to take some time off, as your psychiatrist has suggested, don't hesitate to do that. You would emerge out of it well with suitable help. Follow their advice, go for second opinions if needed, and don't lose hope, because it's the hope which sustains us. Also, look after your own lifestyle, go for regular walks, eat right. That has profound effect on your mental health too. So that's my advice, if that's sufficient.
Thank you so much, Dr. Siddhartha. It's a real pleasure to have you with us in the studio today, and thank you for your valuable informations and your advices.
Thank you so much, Dr. Hafsa. It has been a privilege, and I'm so thankful that you gave me an opportunity to talk to you and to your viewers.
Thank you.
Thank you.
Dear viewers, I hope that today our short discussion about some major and common psychiatric issues will bring minimum help to you. And if you follow this, and if you believe that psychiatric issues are common and it's normal, it's just another illness like having any other physical illness, and you seek for help, I think the power is yours. Thank you. Take care.
TBN 24 টেলিভিশন দেখতে আজই কল করুন 7187776556 লগ ইন করুন www.totalcablebd.com।
নিউ ইয়র্ক থেকে সম্প্রচারিত TBN 24 টেলিভিশন বিশ্বজুড়ে বাঙালির কণ্ঠস্বর।